Prime Minister Narendra Modi has been reviewing the preparedness of the COVID-19 vaccine by visiting facilities over the weekend, by holding virtual meetings with various companies. But what is important at this point and what we need to understand is how close is India to a rollout? We know the Prime Minister has also called for an all-party meeting. So there is really a 360-degree approach that the government is trying to adopt, but are we close to a vaccine rollout at all? Abantika Ghosh, who tracks health for us and is heading our COVID coverage, will help us find answers in this episode of Government Matters. So do send in your questions. So Abantika, let's just first talk a little bit about what the Prime Minister has done over the last 2 days and what it signifies.
The Prime Minister last Saturday, he went on a 3-city tour, Ahmedabad, Hyderabad and Pune, to look at the 3 vaccine candidates. So he visited the manufacturing facilities of the 3 vaccine candidates which are the most ahead. These are Serum Institute in Pune, which is working on the Oxford vaccine, the Bharat Biotech facility in Hyderabad, which is working on India's first indigenous vaccine, Covaxin, and the Zydus Cadila facility in Ahmedabad, which is working on a DNA vaccine, Zycov-D. So these 3 facilities he visited, and then yesterday he had a virtual interaction with 3 other companies who are, you can say, who are in the second line of the race. Biologicals E, Sputnik, Dr. Reddy's. Dr. Reddy's is actually holding the clinical trial for the Sputnik 5 vaccine, and Genova Pharmaceuticals. So these 3 he had virtual interactions. So Sputnik 5 is also in phase 2-3 trial. So to that extent, it's at the same level as the other 3. But because manufacturing in India, they've just signed the deal, and he was basically visiting manufacturing facilities on Saturday. So that's probably why Sputnik, Dr. Reddy's was a part of the virtual interaction rather than an actual visit.
Right. Okay. So Abantika, now all this sounds very promising, but realistically, how close is India to a rollout? Are we looking, what is the time frame that we're looking at this point?
Depends on what you mean by a rollout. Serum, for example, if the Oxford vaccine gets approved in the UK, Serum last week said that they will probably move that data, they'll submit that data to the drug controller here, and they'll move for an emergency authorization maybe in the next 2 weeks, which means by the new year, there could be a licensed vaccine. And Serum has already said that they have 40 million doses ready. Now here's the problem. So if we have already said that the first people who will get it are the healthcare workers. So if we look at, say, healthcare workers, frontline workers, elderly, comorbid, as the first 4 groups of people who will get it, we are, looking at probably a 30 crore estimate, 30 crore number. So, all the ifs and buts and vaccine wastage in transit, all of that taken together, we'll probably need 400 million vaccines for that. Now, if we can manufacture 800 million vaccines in 2021, any vaccine, no one company will, though Serum has said that they by January, February, they'll be able to do 100 million vaccine doses a month. But if 800 million vaccine doses are available in 2021, then probably these priority groups will be covered.
Right.
Which means people like us
will still not
get it. And then that will go to 2022, which is what the AIIMS director had said, Dr. Randeep Guleria, that it will probably be 2022 before the
general population gets it.
Here's the problem. Because we have rushed the vaccine, there are safety concerns. That's a different concern. We don't know how long the vaccine is going to be effective. What if it is like the flu vaccine,
where you need to take it annually?
Right. In which case, by the time 2022 our turn comes, this group will need to get revaccinated. What happens then?
Right.
What are the logistics? So there are, the question you asked, there are no easy answers. There are so many ifs and buts in it that ifs, buts, unknowns. That's the problem with vaccines right now.
Right. So Abantika, you did mention safety concerns, but that's something that for lay people like me, it is a concern, and we would want to try and understand what kind of safety concerns are we talking about, and how can we be sure that the vaccine will not have any adverse impacts in the long term?
There is no scientific evidence to show that any of these vaccines will not have adverse long-term impacts simply because nobody has studied them that long. The disease is just a year old now. and the vaccine development started sometime in March. Oxford started sometime in April. So the short answer is we don't know the long-term effects. We don't know how long the
Immunity will last.
The immunity will last, and we don't know how much safe those vaccines are over the long run. Also, see, the thing is, these are trial stage vaccines. Even for vaccine rollouts, vaccines that had been tried and tested. For example, when the pentavalent vaccine was rolled out in the universal immunization program, I think somewhere in 2015-16, there were reports of children falling ill. There was a huge problem. The countrywide rollout was delayed while all of that was being examined. These are usual things that happen in vaccines, because a vaccine, say serum is testing on 1600 volunteers. A vaccine, when it goes to 1600 people and when it goes to 30 crore people or 10 crore people, different people react differently. There are many things that can happen, many things that can crop up. It's a matter of investigation then whether it's because of the vaccine or something else. But those things
are possibilities.
Those things are possibilities, and I would even say those things are certainties. Some of that would have to happen.
Right. Okay. So I'll start with this first question, which is from Saloni Patel. Will the recent controversy between SII and a COVID volunteer affect the AstraZeneca vaccine approval in India? So we've already had a controversy, right? I mean, we're talking about possible side effects, and we've already had these controversies. Let's talk a little bit about that.
Okay. To answer the question first, the SII volunteer, before coming here, I was just reading that petition. What he has described is quite serious, the kind of symptoms he woke up with, and his complete inability to do normal functions. So that's quite serious. However, for a trial, what happens is there is something called the Data Safety Monitoring Board for every trial. So, and it is the remit of the DSMB to look at the data, to look at the symptoms and take a call on whether this is because of the vaccine or whether it is because of something else. Now, this person in his petition has sort of given arguments to say that I am in the vaccine arm of the trial. But DSMB had, even before the news broke, DSMB had already studied that data. They had gone through all the reports and they had decided that no, this is not because of the vaccine, and the vaccine trial can go on. Now, you can argue either way, but there's a set mechanism,
right?
And that mechanism has cleared it. If you question that mechanism, then it's your call whether you want to take a vaccine or not. However, what is likely to happen with this is not so much in terms of regulatory approval, but public perception of, already there are, anti-vaxxers are going up all around the world. You've seen with measles, you've seen with umpteen vaccines, that there is a whole lobby that works on saying that no, vaccines don't work, they expose your body to needless risks. This will just give
more impetus
their voices, it will just make those voices louder.
Right.
In the end, I think whether you want to take a vaccine at this stage of the disease or whether you want to continue, and let me tell you, I mean, not just me, experts are all saying that your mask and hand hygiene are very effective masks, very effective vaccines.
Right.
So whether you want to take it or not, I think it's your call. But to say that it will affect regulatory clearance, I think is not I don't think that will happen.
That's correct. All right. Kisalaya Jha, are there any plans being made as to how the vaccines will be distributed? So is there coordination between the centre and states already about the rollout plan or distribution plan?
Yes. So last week there was a meeting with the states on the vaccine distribution plan. So in the first phase, if we are looking at, say, 30 crore people we are looking at, but obviously you can't vaccinate 30 crore people at one go, right? So you will go one group at a time. If you take healthcare workers and doctors as one group, the highest priority group, then you're looking at 3 crore people, and that's actually the number of people you already vaccinate under your universal immunization program. So we have 2.64 crore babies and their mothers. We vaccinate them every year. So you have those 28,000 cold storages and the 70,000 vaccinators. All of that is already there. They're in the field. the government is also reaching out to the private sector and asking them, so how many vaccinators can you give us, in what states, and for how much duration? All of that negotiation is currently happening. But effectively, we are going to use the same infrastructure that we have used so long for the vaccination program for babies and mothers.
Right. Okay. Aryan Prakash, will the vaccine be distributed to students with priority, keeping in mind the necessity for opening schools and colleges? So are students part of the priority group at all?
Not right now.
Right. Akshay Kashyap, with the availability of vaccine in sight, do you think international travel is likely to open up? So is that is that another thing that we are looking at, that as soon as there is a bit of the vaccines are available, there would be more opening up of international travel?
Yeah, but I think what I foresee is that there would be a yellow fever kind of situation when you will be required to carry those vaccine certificates. You'll need to get, so for example, when you travel to some African countries,
Right.
you need the vaccination.
Correct.
You need to have the certificate before you board the plane. So I think that many countries would put those sorts of requirements before actually opening up travel.
Right. Okay. Ajay Patel, the Biden-Harris administration has made it clear that vaccine will be provided for free to all. Can we expect the same in India? So let's talk a little bit about the costing of the vaccine.
We're talking about huge differences. Okay. We're talking, so for example, Serum is saying that Serum received a bit of funding from COVAX, which is Bill and Melinda Gates Foundation and Gavi and all of those things. It's an international consortium. So they received some funding from COVAX. So on that, they are saying that we will sell to governments at $3, which is 225 rupees per dose. Then, but outside of government, if you're buying it privately, then that will cost you about double that amount, about $6 per dose, which Bharat Biotech has not said anything, but the Bharat Biotech MD had actually said that it will be cheaper than water. And Bharat has this, it has a track record of giving really inexpensive vaccines. Their rotavirus vaccine is priced at $1 per dose. So that's Bharat's track record. The other vaccines we are not even talking about right now, Pfizer, Moderna, because Pfizer is very close to getting approval in the US, and both will probably cost something like $30 to $40 per dose, which is 10 times.
Right.
So obviously, if we are looking at free vaccine, nobody has so far come out and said that yes, everybody in the country will get free vaccine. But obviously, if that sort of a situation arises also, it is hardly possible for a Pfizer or a Moderna vaccine to be given out
free to everybody.
It has to be one of these vaccines that we are talking about.
Right.
The Zycov-D, the Zydus Cadila vaccine, we don't know how much it will cost, and it's a little bit of different technology. Bharat, for example, it's a very simple vaccine. It's an inactivated virus, whereas Zycov-D is actually a DNA vaccine. So whether that sort of sophistication in technology will add to its price, we don't know that as yet.
Right. So many unknowns in this area as well. All right. Okay. Ashish Chawla, has India reserved or pre-booked some quantity of vaccines with any vaccine contender companies? Which of the contenders has the best chance of local manufacturing?
No, we haven't pre-booked any. And basically the vaccines that we are talking about right now, Zycov-D, Covaxin, Covishield, these are the ones, all of them are locally manufactured. Serum is in the process of ramping up production. So all of these are contenders, and see, the thing is, there is, right now there is a lot of speculation about corporate rivalry kicking in, but let's face it, we are 130 crore people. There is no company probably on earth who can make vaccines enough for all 130 crore people, and all of these vaccines, except the one vaccine that Biological E is working on, all of these are 2-dose vaccines. So 130 crore into 2, if that's the number of vaccine doses we are talking about, nobody has that kind of capacity. Right. So there is room in India for all vaccine manufacturers and some more to come in.
Correct. Okay. I have many questions, but let me just try taking a couple of last ones. Tarush, who will provide the cold storage, airplane security for vaccine distribution, private sector or government?
Government right now is looking at government, because the cold storage facility and the vaccine, the refrigerated vans and all of that, which are used for transporting the vaccines, the 12 vaccines that are in the UIP, that infrastructure will be used for this vaccine as well. So right now it's the government, but at some point, obviously, for example, the Sputnik 5 vaccine had to be flown in because at that point of time it was not being manufactured in India, but the trials had to happen, it had to be flown in. So that was a private airline which flew it in. So those are, I think, arrangements that companies will also have to make. But right now, all these vaccines that we have, that we are talking about, are being manufactured here. So the flying in bit is not relevant there.
As of now. Okay, I'll take one last question from Radhika Ghosh. After inoculating, what percentage of our population with the Oxford vaccine can we realistically see the effects? Can't say.
Can't say. Nobody knows. We don't know. We don't know because there are cases of reinfection, reports of reinfection. As I mentioned right at the beginning, that you don't know how long the immunity will last. What if it lasts just 1 year? Then all these calculations are completely gone. So we actually don't know.
Right. So as Abantika pointed out, many ifs, buts and unknowns as far as the vaccine situation in India is concerned. No easy answers there, but of course the government trying to review preparedness, trying to ensure that a rollout can happen soon. Thank you so much for watching Government Matters and for sending in your questions. Keep subscribing to our YouTube channel.